Hey there, future CNAs. Ready to level up your skills and confidence? This video is just the beginning. We have even more CNA practice tests and lessons waiting for you, and the best part, it's completely free. So check it out. Now let's get started.
Question 1. You are going to perform a full bed change on a resident. What is your first step in communicating the steps with the resident? A. Walk in, explain the process to the resident, perform bed change. B. Knock, walk in, introduce yourself, explain that you are there for a full bed change, perform bed change, ask if there is anything else you can do or get for the resident before you go. C. Knock, walk in, perform bed change, ask the patient if they need anything else. D. Walk in, explain why you're there, perform bed change, ask if the resident needs anything else before you go. The correct answer is B. Knock, walk in, introduce yourself, explain that you are there for a full bed change, perform bed change, ask if there is anything else you can do or get for the resident before you go. It is always courteous to knock before entering, introduce yourself, explain why you're there, and follow up with, "Is there anything else I can get you or do for you before I leave?" This may cut down on answering call lights if the resident already has everything that they need. Question 2. You are taking care of a resident who began hospice care last week. Today, she is unable to speak, and you are unsure if she can hear. The patient's daughter is at the bedside. How would you enter her room for private care? A. Come in and start performing your care. The patient is near death and can't hear. There's no need to introduce yourself if she cannot hear you. B. The daughter is in the room, so you tell the daughter what you're going to do for her mom. C. Let the daughter provide the care. After all, the family members know the residents the best. D. Knock, introduce yourself, and explain to others, the daughter and the patient, why you are there. Proceed with care to be given. The correct answer is D. Knock, introduce yourself, and explain to others, the daughter and the patient, why you are there. Proceed with care to be given. Residents should always be treated with respect no matter what stage of life they are in. It is important to knock, introduce yourself, explain why you're there, and acknowledge everyone in the room. Even if a patient is unable to hear, see, or speak, they should be treated like any other patient. Studies show that hearing is one of the last senses that humans lose during the final stages of life. Question 3. You are in a rush to get your morning round of patient care done, but your patient is in the middle of a story that he wants to tell you. How should you address this with the patient? A. Slowly start walking backward toward the door. Maybe the patient will get the hint. B. Keep doing your duties for this patient. They talk like this all of the time. C. Kindly explain to the patient that you have multiple other patients to see and that you would love to finish this story after your first morning rounds. Assure the patient you will come back when you are free. D. Sit and talk with the patient. Your other patients can wait. This patient really wants to tell you this story, and it's rude to interrupt. The correct answer is C. Kindly explain to the patient that you have multiple other patients to see and that you would love to finish this story after your first morning rounds. Assure the patient you will come back when you are free. C is appropriate because you do have multiple other patients and must ensure that they are taken care of. Making the patient feel that you care about their story is important. Walking toward the door makes a patient feel as though you are in a rush and what they are saying isn't important. Question 4. You have a resident that has specific religious beliefs and has asked the kitchen to not send certain items on her tray. Upon delivering her tray, the resident tells you that she cannot eat this tray because of her religious beliefs. As the CNA, what is your next step? A. Tell her that you are sorry the kitchen has closed and she will have to eat it or wait until morning. B. Tell the resident to call a family member to have food brought to her. C. Take the tray out, contact the nurse in charge, and assure her that you will be back shortly with a tray that fits her religious beliefs. D. Tell the patient to call a pizza delivery service since the kitchen has closed. The correct answer is C. Take the tray out, contact the nurse in charge, and assure her that you will be back shortly with a tray that fits her religious beliefs. The resident should never be denied food. The first step is to notify the charge nurse using the chain of command to diffuse the issue. Letting the patient know that you will be back with food lets them know that you are addressing the issue and you understand that it is important for them to eat. Question 5. A resident that usually loves going to bingo game nights is sitting in her room crying. She states that she does not want to go to bingo tonight. What is your response to her? A. Okay, you don't have to go. Maybe another night. B. Why don't you want to go? All of your friends are there. C. There are going to be lots of fun prizes. You should go. D. It's okay if you don't want to go, but do you want to talk about why you don't want to go to bingo? The correct answer is D. It's okay if you don't want to go, but do you want to talk about why you don't want to go to bingo? Acknowledging the resident's feelings and asking her if she'd like to talk about it is appropriate. All of the other options blow off the resident's feelings and can make her feel like her feelings do not matter. Question 6. You, as the CNA, see a nurse give a patient milk, which the patient is allergic to. This nurse has been made aware of the patient's allergy multiple times and has been asked to stop giving the patient milk on several occasions. What is your next step? A. Nothing. This is not your concern. B. Tell your nursing supervisor. C. Tell the nurse that she shouldn't give the patient milk. D. Tell the patient that you are sorry they got milk, but that is all the kitchen had to drink. The correct answer is B. Tell your nursing supervisor. Patient safety is always the concern. The nurse has been made aware of the allergy and has been asked on several occasions not to provide milk to this patient. You should use your chain of command to properly report this incident. Question 7. You have a resident on day shift that is refusing a shower. He has not had a shower in 3 days. How would you respond to this resident? A. Tell him he must take a shower so you don't get into trouble for not doing your job. B. Tell him you will call his daughter, his POA, if he does not agree to take a shower. C. Gently force him into the bathroom until he agrees to shower. D. Explain to him that it is his right to not take a shower and that you can try again tomorrow. The correct answer is D. Explain to him that it is his right to not take a shower and that you can try again tomorrow. The patient has a right to not take a shower. Consider why the patient may be refusing. Are they uncomfortable with a female giving them a shower? Does he like his showers in the evening versus the morning? Building rapport with the resident is key. Question 8. A resident is hitting and kicking you while you and another CNA are trying to provide care. What should you do? A. Sit on the patient's hands until the nurse arrives. B. Yell for the nurse to bring a sedative. C. Ask the second CNA to get the nurse. D. Tell the patient they better stop hitting and kicking. The correct answer is C. Ask the second CNA to get the nurse. The priority is always patient safety. It is important for a staff member to remain with the patient so that the patient isn't a risk for harm to themselves or others. Further, sending the second CNA to get a nurse to assess the patient saves time, and the patient can receive the proper care more quickly. Question 9. You need to use a Hoyer lift to transfer a patient. The patient is a to-assist. You're in a hurry. You bring the Hoyer lift into the room and the resident asks, "Are you going to get someone to help you?" What should you tell the patient? A. No, I'm in a rush. You will be okay. B. Yes, I will get another CNA to help. Your safety comes first. C. Explain to the patient that you are in a rush, but you will be extremely careful and make sure she isn't hurt. D. Tell the patient that if she thinks she needs 2 people to transfer her, you will come back later. The correct answer is B. Yes, I will get another CNA to help. Your safety comes first. The patient's safety is first. This answer ensures the patient that her needs and feelings are being acknowledged as well. Question 10. The resident's son is concerned that the resident is not receiving proper care at the facility that you work at. What is your response to the resident's son? A. Tell the son that you agree that his dad is certainly not receiving proper care. B. Listen silently and offer support to the son. Explain to him that he is welcome to speak to the administrator if he would like. C. Tell the son that you wouldn't allow your family member to be a resident at this facility. D. Ask the son if there is anywhere else he would like his dad to go. The correct answer is B. Listen silently and offer support to the son. Explain to him that he is welcome to speak to the administrator if he would like. The CNA should never engage in family issues or put down a facility. Explaining to the family that they may speak with the administrator is appropriate. It is best that the CNA always direct the patient's family to upper management when grievances occur. Question 11. You have a patient that pushes his call light every few minutes. Most of the time, the patient just wants to talk. What is your response to the patient? A. Tell the patient that the staff is way too busy to keep running to his call light. B. Tell the patient that he should only use his call light when necessary. C. Move the call light where the patient cannot see it. He doesn't need anything important anyway. D. Explain to the patient that you will stop by his room more often to check on him. The correct answer is D. Explain to the patient that you will stop by his room more often to check on him. Taking the call light from the patient can be considered abuse. Not acknowledging the patient's feelings can harm the patient emotionally. This patient is more than likely anxious and needs someone in his room more often. Question 12. You have a resident that says her family never visits her. The resident begins to cry. What should you say to the resident? A. Listen intently as the resident speaks about her feelings. B. Tell the resident that she doesn't need to worry about her family. They will regret not seeing her one day. C. Ask the resident if she needs to speak to a therapist. D. Tell the resident she has no need to worry. Her family is probably busy working, but will come see her soon. The correct answer is A. Listen intently as the resident speaks about her feelings. Listening quietly lets the patient know that you're listening and that her feelings are important to you. It is never okay to brush off or downplay a patient's feelings. Telling the resident that her family is probably coming soon is providing false hope and should be avoided. Question 13. You have a resident that is blind. What is the best way to communicate with this resident? A. Turn on all the lights and speak very loudly. B. Sit in front of the patient and speak clearly. C. Hold the patient's hands and speak directly in front of their face, speaking slowly. D. Introduce yourself upon walking in. Explain to the resident that you are going to sit in front of them while they are talking. Speak clearly and directly to the resident. The correct answer is D. Introduce yourself upon walking in. Explain to the resident that you are going to sit in front of them while they are talking. Speak clearly and directly to the resident. Although B is right, introducing yourself is more appropriate because the resident cannot see you. Also, C is only okay if the patient gives you permission to personally touch their hands. Question 14. The nurse asked you to take your resident orange juice. Once you get to the kitchen, you can't remember if the nurse asked you to take the resident orange juice or apple juice. You take apple juice to the resident. The nurse gets angry with you and asks, "Can't you do anything right?" How do you respond? A. I apologize, I forgot what kind of you asked me to bring. Next time I will try to remember. Please be kind and remember that we are all human. B. Say nothing. You brought the wrong juice. You were in the wrong. C. Tell the nurse to get the orange juice herself next time so you won't forget again. D. Say nothing. The nurse is probably having a bad day. The correct answer is A. I apologize. I forgot what kind of you asked me to bring. Next time I will try to remember. Please be kind and remember that we are all human. Acknowledging the fact that you brought the wrong juice to the resident is right. However, the nurse was in the wrong for saying, "Can't you get anything right?" It is okay to communicate to the nurse that you don't appreciate the way she spoke to you and remind her to be kind. Question 15. You come into work and you are assigned to a different hall than usual. You have a resident that you have never met before. What is the proper way to introduce yourself at the beginning of your shift, and what do you call the resident? A. Introduce your name to the resident. Her name is on the care plan, so no need to ask her what her name is. B. Introduce yourself to the resident and ask her what name she would like to be called. C. Walk in and call the patient by the name on her care plan. Your name is on your badge so she can read it. No need to tell her what your name is. D. The charge nurse already told the resident your name and told you the name of the resident, so no need for a proper introduction. The correct answer is B. Introduce yourself to the resident and ask her what name she would like to be called. It is important to be courteous to the resident. Even if her name is on the care plan, the resident may prefer to be called another name. It is always imperative to introduce yourself as well. This helps build rapport with your residents. Question 16. You walk into your resident's room, and she complains that her right hand, which has IV fluids running in it, is causing her pain. What do you say to the resident? A. It should be fine. Your hand isn't red. B. I will get the nurse to assess it for you. C. I'm sure it's fine. It doesn't have much more to infuse. D. I will stop the fluids and let your nurse know, but I'm sure it's nothing. The correct answer is B. I will get the nurse to assess it for you. This statement shows the patient that her concerns are valid and that you will retrieve the correct personnel to assess her pain and the cause of her pain. Blowing off the patient's pain is never okay. D is incorrect because the CNA is unable to stop IV fluids. This is not in their scope of practice. Question 17. A patient's family member comes into the room while you are speaking with the patient. The family member begins to complain about her mother not having a bath since 3 days ago. What would you say to the daughter of this resident? A. Your mom has been offered a bath each day this week. She has declined a bath each night. Unfortunately, I cannot make her take a shower, but I have strongly encouraged her to take a shower. B. I cannot force your mom into taking a bath. C. She will be fine. She said that she doesn't want to take a shower. D. Your mom doesn't want to take a shower. When she is ready, I will gladly assist her with one. The correct answer is A. Your mom has been offered a bath each day this week. She has declined a bath each night. Unfortunately, I cannot make her take a shower, but I have strongly encouraged her to take a shower. This answer assures the patient's daughter that her mother is being asked if she wants to take a shower, but that it is the patient that does not want to shower. It assures that the patient's daughter that the patient's needs are being addressed. It is necessary to explain to the daughter that the patient cannot be forced into taking a shower. Question 18. You notice your resident is grimacing when you walk into his room. He is reluctant to say that he is in pain. What should you, as the CNA, do? A. Explain to the resident that if he is in pain, it's okay to talk about it so that you can report it to the nurse. B. Nothing. The patient said he is fine, so he must not be in pain. C. Tell the resident that he doesn't have to be tough. If he is in pain, he should tell you. D. Say nothing to the resident but report the pain to the charge nurse. The correct answer is A. Explain to the resident that if he is in pain, it's okay to talk about it so that you can report it to the nurse. Acknowledging the patient's feelings is important. Some cultures do not allow one to express their pain, so the patient could be in a lot of pain, but because of his culture, is unable to speak about it. Question 19. Your resident tells you that he is certain that another CNA stole his glasses. What should you say to him? A. I'm sure no one stole your glasses. No one would do that. B. If you cannot find them in his room, tell him that you will report this immediately to the nursing supervisor. C. Don't worry, I'm sure they're here in your room somewhere. D. Let's not accuse anyone of stealing. Have you looked for them? The correct answer is B. If you cannot find them in his room, tell him that you will report this immediately to the nursing supervisor. Sometimes residents can get confused and forget where they left their personal items. Helping the patient look for them is the right thing to do. If the glasses cannot be found, reporting this to the nursing supervisor is appropriate. Question 20. You are providing perineal care to a resident when a second CNA barges into the room without knocking. What would you say to the CNA? A. I am providing care to this resident. Please be sure to knock for the resident's privacy when entering the room. B. Say nothing. The other CNA is not your concern. C. I know you were trained to knock before entering a resident's room. D. It's rude to not knock before coming in. Please be sure to knock next time. The correct answer is A. I am providing care to this resident. Please be sure to knock for the resident's privacy when entering the room. The patient's privacy should always be protected. This response also ensures you are not causing conflict with other employees, but simply asking them to respect the resident's privacy.
Thank you for watching this video, and we hope it was helpful. Click the link right here to start your free 3-day trial to CNA Premium, which has over 1,000 practice questions that will help you pass your CNA exam on your first try.